I'm John Hoddinott. I'm a professor of nutritional sciences and applied economics at Cornell University. In terms of the work we're doing in Bangladesh, there are really two broad sets of objectives, one of which revolves around improving the quality of people's lives, specifically the diets, the types of foods they consume. But importantly, a part of this is to say, can we actually intervene in this space in a way which is sustainable? So to amplify this idea of sustainability, we know from just a casual glance around the world in low and middle income countries, even in the United States, at any one time there are thousands, if not tens of thousands of interventions going on. We have good methods for trying to understand how well they work. We apply those methods before we start these interventions, when the interventions come to an end, but we never really ask ourselves, well, do these make a difference in the long term? If we were to go back 4 or 5 years later, would we still see sustained evidence of impact? And that's what we're trying to do in this study. So the original ANGeL study, designed by myself, but particularly my colleague, Dr. Akhtar Ahmed, in collaboration with the government of Bangladesh, focused on trying to improve diversity of production in rural areas, diversity of consumption in rural areas, and also improve the status of women. To give this a little more context, in the last 40 to 50 years, Bangladesh has done an amazing job in terms of improving the quantities of food available, going from a country that was at the brink of starvation on independence to one where, in general calorie type terms, the way in which we could measure diets, people are able to consume enough calories to live a healthy, rather reasonably healthy life. But as in anything in life, you can have too much of a good thing. Many people in rural areas of Bangladesh get more than 80% of their calories from rice, so they get a lot of energy, but they don't get a lot of diversity. So the goal of our study was to actually design a series of interventions to, in the first instance, improve or increase the availability of a diverse set of foods for rural households, encourage those households to consume that, and do so in a way which actually strengthened the position of women within households. So there was a component of the study that focused on agriculture, that's the A in ANGeL, a focus on nutrition and nutrition knowledge, that was the N, and a focus on gender and gender relations, which is the G in ANGeL. In order to put our current study in context, it's helpful to just briefly summarize the results of the initial ANGeL evaluation. What we found is that treatment arms that included agriculture, either by itself or with nutrition or gender, did lead to increases in household agricultural production and, importantly, diversification of that production. Treatment arms that included both agriculture and nutrition affected both the production but also improved the quality of household diets. The original study itself concluded in 2017, 2018. Since that time, there was a cyclone that affected part of Bangladesh, and importantly for our purposes, there was the COVID-19 pandemic. Effects in rural Bangladesh were largely economic effects. Fortunately, relatively few people were directly affected in terms of being sick or even worse, dying, but it caused significant economic disruption. And what we wanted to see in this study was whether or not being a beneficiary of the ANGeL intervention actually made you resilient to these particular shocks. So we're in the midst of analyzing our data, which is just a slightly fancy way of saying some of these things may change, but it may be helpful to share some of our very preliminary results. One of the things we asked our respondents about in the current survey round was how they coped with the COVID-19 pandemic. How were they affected? How did they respond? And one of the things we see in that is that households that participated in the ANGeL intervention, particularly those that got both the agriculture and the nutrition treatment, fared somewhat better than those households that didn't. Okay? They were less likely to adopt what we called livelihood coping strategies. They were less likely to borrow money, to buy food. They were less likely to defer important non-food expenditures like on health and education and the like. We also see that coming out of the pandemic, levels of per capita consumption, it's kind of a metric for like household income, or one possible metric for household well-being, is higher in those treatment arms that receive both the nutrition and the agricultural training. And those households were less likely to experience drops in consumption. between the previous survey we did, pre-COVID, and the survey we did in 2022. So putting all this together, and again stressing the results are preliminary, this suggests that certain components of the ANGeL intervention promoted resilience for rural households in Bangladesh.